that's a small scale. That's just our little practice,
Hmm.
trying to put our heads together. But, afar in organizations like that that are doing much larger pieces of research with much more, integrity, academically, clinically, the kind of insights that we get so that we can ask better questions,
Yeah.
know better where to look, what rocks do we want to turn over, and then align conceptualization and diagnosis and treatment around that. It's only going to be to the betterment of the people we're serving.
Yeah. No, I mean, back in the day, the research was sort of very gathering up of stories and what are the common
Mhm.
themes that we're seeing with sex addicts. And then
Right,
we were able to do more research on, what actually is contributing to positive outcomes. And
right.
what are we seeing that shows up with, sex addicts who have like solid, consistent sobriety? What's going on there? Um,
Hmm.
and there's some initial research done about disclosure. I actually think that there's a woman doing a graduate study right now
Yes,
that is doing more research because we need more research on
that's right.
disclosure. Is it effective? What are the aspects that are effective? What do we recommend? I mean, we have a lot of clinical insight, but that
Yes.
other piece is really important. And there's all these things. I
Yeah.
know that in our practice, we have always felt very strongly about being on the cutting edge,
Hmm.
understanding the neurology,
Right.
understanding the trauma pieces, understanding the hyper focus that comes and what gets in the way. Um,
Hmm.
because the more that we understand, and like you said, the more research that's being done, what are the common themes that are coming into sex addicts who are walking in the door?
Right.
How do we identify that group? What
That's right.
what are the interventions that are most helpful? How when we see cravings, that's not the word I'm looking for. When we see withdrawal,
Mm-hmm.
how does that show up with sex addicts? And is there something that we can do to help them move through that withdrawal experience more quickly?
Yeah.
All of that research is so essential for us to do this work.
That's right. And you just outlined, this progression from, okay, it's sort of like a guru based theory, right? All the people who
Uh,
actually do this and are experts, they come together, they pool their knowledge, which is important. That's actually how any sort of domain begins to develop a literature, right?
mhm.
Is that more sort of qualitative approach to research, just trying to understand the phenomenology of it as best we can. And then based on that, and then we can start asking sharper questions and doing more of the quantitative and more objective sort of research. That's a natural linear progression in the development of any body of research. And so I say that to say, I know where our intention isn't to say, well, they used to not do it right and we do
Oh
it
no.
better. No, it's not that. It's like we're standing on their shoulders. We're grateful,
Oh,
so grateful for that work. And now, because of the work they did, now we get to come along and build on that and improve upon it um and begin to understand these little nuances, like you said.